Anatomy and Physiology of the Digestive System. Welcome. If you are new, please like, subscribe and hit the notification bell for updates of my new video. Organs of the digestive system and associated structure. The two divisions of the digestive system are the alimentary tube and the accessory organs. The alimentary tube extends from the mouth to the anus. It consists of the oral cavity, pharynx, esophagus, stomach, small intestine, and large intestine. Digestion takes place within the oral cavity, stomach, and small intestine. Undigestible material, primarily cellulose, is eliminated by the large intestine, also called colon. The accessory organs of digestion are the teeth, tongue, salivary glands, liver, gallbladder, and pancreas. Digestion does not take place within these organs, but each contributes something to the digestive process. Mechanical digestion is the physical breaking up of food into smaller pieces. Chewing is an example of this. As food is broken up, more of its surface area is exposed for the action of digestive enzyme. Chemical digestion. Chemical digestion of broken up food particles, in which complex chemical molecules are changed into simpler chemicals that the body can utilize. Such enzymes are specific with respect to the fat, protein, or carbohydrate food molecules each can digest. The functions of the gastrointestinal tract include secretion, digestion, absorption, motility, and elimination. Food and fluids are ingested, swallowed, and propelled along the lumen of the GI tract to the anus for elimination. The smooth muscle contract to move food from the mouth to the anus. Before food can be absorbed, it must be broken down to a liquid called chyme. The oral cavity includes the buccal mucosa, lips, tongue, hard palate, soft palate, teeth, and salivary glands. The buccal mucosa is the mucous membrane lining the inside of the mouth. The tongue is involved in speech, taste, and mastication. Small projections called papillae cover the tongue and provide a roughened surface, permitting the movement of food in the mouth during chewing. The hard palate and soft palate together form the roof of the mouth. Adults have 32 permanent teeth, 16 each in upper and lower arches. The different types of teeth function to prepare food for digestion by cutting, tearing, crushing, or grinding the food. Swallowing begins after food is taken into the mouth and chewed. Saliva is secreted in response to the presence of food in the mouth and begins to soften the food. Saliva contains mucin and an enzyme called salivary amylase or ptyalin, which begins the breakdown of carbohydrates. The oropharynx and laryngopharynx are food passageways connecting the oral cavity to the esophagus. No digestion takes place in the pharynx. Its only related function is swallowing, the mechanical movement of food. When the bolus of food is pushed backward by the tongue, the constrictor muscles of the pharynx contract as part of the swallowing reflex. The reflex center of the swallowing reflex is in the medulla, which coordinates the many actions that take place: constriction of the pharynx, cessation of breathing, elevation of the soft palate to block the nasopharynx, elevation and closure of the epiglottis, and peristalsis of the esophagus. Swallowing is rather complicated, but because it is a reflex, we do not have to think to do it correctly. Talking or laughter may interfere with the reflex and cause food to go into the wrong pipe, the larynx. When it happens, the cough reflex is usually effective in clearing the airway. The esophagus is a muscular tube that takes food from the pharynx to the stomach. No digestion takes place here. Peristalsis of the esophagus propels food in one direction, and ensures that food gets to the stomach even if the body is horizontal or upside down. At the junction with the stomach, the lumen of the esophagus is surrounded by the lower esophageal sphincter or cardiac sphincter, a circular smooth muscle. The LES relaxes to permit food to enter the stomach, then contracts to prevent the backup of the stomach contents. If the LES does not close completely, gastric juice may splash up into the esophagus. This is a painful condition we call heartburn, or gastroesophageal reflux disease. Most people experience heartburn once in a while and it is merely uncomfortable, but chronic GERD is more serious. The lining of the esophagus cannot withstand the corrosive action of gastric acid and will be damaged, perhaps resulting in bleeding or even perforation. Medications are available to treat this condition. The function of the upper esophageal sphincter is to prevent air from entering into the esophagus during breathing, and to prevent reflux of esophageal contents into the pharynx to guard airway aspiration. The stomach is located in the midline upper left quadrant of the abdominal cavity, to the left of the liver and in front of the spleen. Although part of the alimentary tube, the stomach is not a tube, but rather a sac that extends from the esophagus to the small intestine. Because it is a sac, the stomach is a reservoir for food, so that digestion proceeds gradually and we do not have to eat constantly. Both mechanical and chemical digestion take place in the stomach. The stomach is also richly innervated with intrinsic factor and intrinsic nerves. Parietal cells lining the wall of the stomach secrete hydrochloric acid, whereas chief cells secrete pepsinogen, a precursor to pepsin, a digestive enzyme. Parietal cells also produce intrinsic factor, a substance that aids in the absorption of vitamin B12. Absence of the intrinsic factor causes pernicious anemia. After ingestion food, the stomach function as a food reservoir where the digestive process begins, using mechanical movements and chemical secretions. The stomach mixes or churns the food, breaking apart the large food molecules and mixing with gastric secretions to form chyme, which then empties into the duodenum. The intestinal phase begins as the chyme passes from the stomach into the duodenum, causing distension. It is assisted by secretin, a hormone that inhibits further acid production and decreases gastric motility. The small intestine is the largest and most convoluted portion of the digestive tract, measuring 16 to 19 feet, 5 to 6 meters in length in an adult. It is composed of 3 regions: duodenum, jejunum, and ileum. The duodenum is the first 12 inches of the small intestine and is attached to the distal end of the pylorus. The common bile duct and pancreatic duct join to form the ampulla of Vater, emptying into the duodenum at the duodenal papilla. This papillary opening is surrounded by muscle known as the sphincter of Oddi. The 8-foot portion of the small intestine that follows the sphincter of Oddi is the jejunum. The last 8 to 12 feet of the small intestine is called the ileum. The ileocecal valve separates the entrance of the ileum from the cecum of the large intestine. The inner surface of the small intestine has a velvety appearance because of numerous mucous membrane, finger-like projections. These projections are called intestinal villi. In addition, the small intestine has circular folds of mucosa and submucosa, which increase the surface area for digestion and absorption. The small intestine has 3 main functions: movement, mixing peristalsis, digestion, and absorption. Because the intestinal villi increase the surface area of the small intestine, it is the major organ of absorption of the digestive system. The small intestine mixes and transports the chyme to mix with many digestive enzymes. It takes an average of 3 to 10 hours for the contents to be passed by peristalsis through the small intestine. Intestinal enzyme aid in the digestion of proteins, carbohydrates and lipids. The large intestine extends about 5 to 6 feet in length from the ileocecal valve to the anus, and is lined with columnar epithelium that has absorptive and mucous cells. It begins with the cecum, a dilated pouch-like structure that is inferior to the ileocecal opening. At the base of the cecum is the vermiform appendix, which has no known digestive function. The large intestine then extends upward from the cecum as the colon. The colon consists of 4 divisions: ascending colon, transverse colon, descending colon, and sigmoid colon. The sigmoid colon, large intestine, bends downward to from the rectum. The last 1 to 1½ inches of the large intestine is called the anal canal, which opens to the exterior of the body through the anus. Sphincter muscles surround the anal canal. The large intestine's functions are movement, absorption, and elimination. Movement in the large intestine consists mainly of segmental contractions, like those in the small intestine, to allow enough time for the absorption of water and electrolytes. In addition to peristaltic contractions are triggered by colonic distension to move the contents toward the rectum, where the material is stored until the urge to defecate occurs. Absorption of water and some electrolytes occurs in the large intestine to reduce the fluid volume of the chyme. This process creates a more solid material, the feces, for elimination. Liver and gallbladder. The liver is the largest organ in the body other than skin, and is located mainly in the right upper quadrant of the abdomen. The right and left hepatic ducts transport bile from the liver. It receives its blood supply from the hepatic artery and portal vein, resulting in about 1,500 milliliters of blood flow through the liver every minute. The liver performs more than 400 functions in 3 major categories: storage, protection, and metabolism. It stores many minerals and vitamins, such as iron, magnesium, and the fat-soluble vitamins A, D, E, and K. The protective function of the liver involves phagocytic Kupffer cells, which are part of the body's reticuloendothelial system. They engulf harmful bacteria and anemic red blood cells. The liver also detoxifies potentially harmful compounds like drugs, chemicals, alcohol. Therefore, the risk for drug toxicity increases with aging because of decreased liver function. The liver functions in the metabolism of proteins, considered vital for human survival. It breaks down amino acids to remove ammonia, which is then converted to urea and excreted via the kidneys. In addition, it synthesizes several plasma proteins, including albumin, prothrombin, and fibrinogen. The liver's role in carbohydrate metabolism involves storing and releasing glycogen as the body's energy requirements change. The organ also synthesizes, breaks down, and temporarily stores fatty acids and triglycerides. The liver forms and continually secretes bile, which is essential for the breakdown of fat. The secretion of bile increases in response to gastrin, secretin, and cholecystokinin. Bile is secreted into small ducts that empty into the common bile duct, and into the duodenum at the sphincter of Oddi. However, if the sphincter is closed, the bile goes to the gallbladder for storage. The gallbladder is a pear-shaped bulbous sac that is located underneath the liver. It is drained by the cystic duct, which joins with the hepatic duct from the liver to form the common bile duct. The gallbladder collects, concentrates, and stores the bile that has come from the liver. It releases the bile into the duodenum via the common bile duct, when fat is present. The pancreas is a fish-shaped gland that lies behind the stomach, and extends horizontally from the duodenal C loop to the spleen. The pancreas is divided into portions known as the head, the body, and the tail. 2 major cellular bodies, exocrine and endocrine, within the pancreas have separate functions. The exocrine part consists of cells that secrete enzymes needed for digestion of carbohydrates, fats, and proteins. The endocrine part of the pancreas is made up of the islets of Langerhans, with alpha cells producing glucagon and beta cells producing insulin. These hormones produced are essential in the regulation of metabolism. Your salivary glands produce saliva and empty it into your mouth through ducts, or small openings. They lubricate your mouth and throat, aid in swallowing and digestion, and help shield your teeth from cavity-causing bacteria. The main salivary gland function is saliva production. Saliva plays an important role in supporting your oral and overall health. For example, saliva keeps your mouth and throat lubricated. Moistens food so it is easier to swallow. Contains an enzyme called amylase, which helps your stomach break down starches in food. Keeps your mouth clean. Helps reduce your risk of cavities and gum disease. Helps maintain the pH balance in your mouth. Thank you for watching. If you want to study nursing anywhere, please subscribe, like, share, and click the notification bell for updates of my new video. If any concerns, just comment below.